Have you guys heard of physical, mental, somatic response? So, somatic memory refers to the body's ability to store and recall past emotional experiences or trauma and the physical sensations that are linked to those experiences. This is based on the idea that emotions and experiences are not only stored in the mind but also in the body. Physical emotional memory, also known as somatic memory or body memory, refers to those lingering physical sensations and body experiences associated with past events, particularly those that were emotionally charged or traumatic. It's that connection between the emotions and the physical body. The reason I wanted to talk about this today is because I'm seeing a lot of this with my mother. My mom is 88 and she has Alzheimer's. I've seen it off and on in the past, but now I see it every day that I'm with her. It's a really sad, very difficult thing to watch, especially because I don't know anything about her past or her potential, maybe trauma. When my mom was 16, she ran away from home and she married my dad when she was 17 years old. We don't know a lot because my mom was gone out of the house at age 16, took off, that was it, got married then after that. So what's coming out now more and more for this poor lady, age 88 with Alzheimer's, is anytime she is experiencing something that triggers that memory in her body, of course, not in her mind, she has no idea. She's not thinking, hey, this thing's connected to this, what we're discussing. So now my body's acting like this. She doesn't have any kind of way to understand it. I used to see this on almost a daily basis with one of the students that I cared for as a school nurse in an elementary school. So this child went through extreme trauma, and it then manifested into those seizures that are not real but look totally real. And it manifested into then even hallucinations for him as he would come in not feeling good, not feeling right. It ruined his day, his childhood, and his life. And I kept wondering what is happening with him when he hallucinates and lives out. It's like watching a play. You're watching this person live out, including the weapon firing, and it was to his mother. But he was young and didn't know really how to respond to this, and it was stored in his body. And then when I would have him in the health room, he would relive it. So finally, after reliving the whole scene, like I said, watching it like a play, I talked to his father, as I always did, what really went on, because I watched it with him. And he said, okay, this is what went on. It then helped me to better understand what this child was going through. But in my mom's case, I don't know what she went through, but she clearly went through something, because when I brought her to the geriatrician, Alzheimer's specialist up at the Brain Wellness Clinic in Seattle, my mom started to experience it. She was sitting to my left. And we were talking to her about the need for her to move, to get more assistance, for some more one-on-one, not just me being a home health care visitor for her, that she needed to move into an adult family home or some type of facility that would give her more care. And that somehow has felt extremely attacking to her, personal, critical. And her response was yelling over and over, what did I do wrong? What did I do wrong? How do I rectify this? Just begging the doctor and I to not do this to her, that she insisted she was fine. And what did I do wrong? Well, we tell her over and over, oh, you've done nothing wrong. This has nothing to do with that. It doesn't matter. You can explain these things. But I think until somebody has spent a lot of time perhaps in counseling, they're not going to get through some of these deep-seated emotional, physical events that are stored in their body and their mind that come out at times. I don't know what happened, like I said, but when my mom feels criticized, pushed, out of her comfort zone, out of control, perhaps that kind of feeling, she goes right back into this childhood trauma of why are you doing this to me? I didn't do anything wrong. Well, what did I do wrong? What's wrong with me? what's wrong with me? I guess I'm sick, just very emotionally charged. But what do you do about that? I would like to know. So there I was with that doctor, and at the Brain Wellness Clinic, I had a Alzheimer's psychiatrist for several visits before that. Now I have this wonderful doctor. There's no answer. This is the sad thing about Alzheimer's. What's the answer? How do you fix this? Well, the Alzheimer's medications don't work, especially in this stage, so that's not going to work. I do have some medication for her if things get really bad and she is very, very emotionally anxious and upset, that I can give her something to help calm her down, especially if we go visit an adult family home. That's a big trigger. 2 questions. What do you do for people like this? It's sad and unfortunate, but also, how do you transition somebody who desperately needs to have more medical care in a dementia facility, long-term care home, assisted living? How do you get them to understand how badly they need it when these 2 doctors and I on a daily basis cannot convince her, because she now resorts back to this emotional event? So while we were talking with her, my mom started shaking. She's sitting over here. She starts shaking, head to toe shaking, starting to cry, saying those things over and over. What did I do? Why are you doing this to me? But when it was happening, I said to the doctor, Dr. Hansen, what do you want me to do when she's like this? What is this? And she said, this is a physical, mental, somatic event. There's something that has been stored in her body and mind that feels traumatic and harmful to her that's coming out like this, at times like this. Her memory is anywhere between 1 to maybe 3 minutes. So in 1 or 2 minutes, all of that will be completely gone out of her memory. In fact, a lot of times while I'm speaking to her, it's going out of her memory because she has no short-term memory abilities anymore. So even though I'm speaking to her, it's not storing anywhere. So that rational conversation I'm having doesn't work. It's sad for so many reasons, you guys. I mean, I can't even describe it. It's sad. It's awful to watch. Do you have somebody that has now gone to the severe stage of Alzheimer's who has some of these emotional, physical, mental events that now are coming up in their older life as they try their best to rationalize with what you're saying? Okay, so today I have a new caregiver company coming. I've asked this person for 3 days a week, just 4-hour shifts. So we're doing a 4-hour shift today. This is the first one. Now remember, I've been through this before. I have lost track. Maybe this is five different home health care places. They're not perfect. In fact, they have a lot of problems. They have a lot of problems with, they don't have enough staff. They don't have people that stay. They get paid very little. Some people with Alzheimer's are very, very, I don't want to say like docile. Let's see. They're very cooperative. They will go along with and trust. They don't have the same issues as my mother does. So if you say a caregiver's coming today, Mom, to help give you a bath and do your meals and your laundry, then your loved one might say, okay, and then that's that. But my mother says, no, I can do it myself. I do it all the time. She doesn't do anything like that. But, she thinks she's still doing it. She thinks she's still cooking. She thinks she's still leaving her house to go play bridge every week. She thinks that she has dinner parties and has a pot roast in the oven. She thinks that she takes baths every day. And she doesn't understand why we're in her space. Okay, enough of that. Cheers, everybody. My favorite iced coffee. I discovered that brown sugar syrup. That's really good. So we're going to head over. I'm glad that you're with me. I'll update you soon. Okay, I'm back. So after I spoke with you, I got to my mother's. The new caregiver and her supervisor arrived. This new caregiver's name is Anne, and she is fantastic. This company is fantastic. I've been through many companies over the years, trying to get the right caregiver for my mom, and usually the caregiver will quit, although we've had some that are extremely disappointing and didn't work out. So this lady, let's hope, you guys, because she has a lot of experience She's worked with geriatric patients and Alzheimer's patients. She's been a caregiver for a very long time. She was amazing with my mother, as was her supervisor, Samantha, who I've met before. This company has been so on top of things and very professional. So Anne stayed 4 hours, and I showed her everything that I do. Between Aunt Samantha and I, we came up with a good game plan and a really good care plan. It'll be 4 hours, 3 times a week. We'll see how it goes, and just praying that this works. I didn't really finish telling you, I don't think, what did that geriatrician at Alzheimer's specialist say to me when I pointed to my mom on my left, who was having her emotional memory event, we'll call it that, although it looks like a intense bout of frustration, anger, tantrum, impulsivity. And that's because with Alzheimer's, you know, the logical part is gone. The executive functioning part is gone. So all that information that we're giving her about a better place to live, what your needs are, this is why, as your physician, I'm recommending this to you, why all of that is met with such just extreme emotional outbursts. Then she goes into I didn't do anything wrong. What did I do wrong? How can I fix it? So what did the doctor tell me? She said, well, I really kind of followed her lead. So she went to my mother closely and said in a very calm and very patient and very peaceful voice, something like this, very, elementary level conversation. Frances, you didn't do anything wrong. Everything you're doing is right. It's me as your physician that sees you need more care. She didn't go into any long-winded things that I tend to do too much. She didn't rationalize. She didn't explain. She didn't say you should. She gave her that information. It's best for you as your physician. Now, when my mom started to kick back with all of that, that conversation coming at her, Dr. Hansen just calmly turned, went back to her desk area. She just calmly turned and started to do some charting. And, then I gave my mom some gentle reassurance. It's okay, Mom. You didn't do anything wrong. And when I reached out to touch her, she recoiled and yelled, don't touch me. She did that. Now they say, the experts do say, when someone is having a somatic event, that gentle touch tends to work. Being calm and patient tends to work. And giving them even a hug, just some comfort measures, grounding measures, tools like that are helpful. But in someone who has Alzheimer's or a brain injury of some sort, and the amygdala, which is the memory area, has been not well for so long and is continuing to get worse, that's where the reasoning and the hippocampus, that's where all this reasoning and conversation and ability to rationalize with that person comes from. But if an Alzheimer's person does not have the ability to reason, or doesn't have any executive functioning skills or any socializing skills, what do you do then? Then what we went into and what we do that seems to work is we, again, like I mentioned earlier this morning when I spoke with you, we wait for it to pass. We sit calmly with her. We don't show any kind of agitation, impatience, annoyance in our voices, and we limit our conversation to the bare minimum, one sentence. Not a lot of explanation because they often aren't able to process that. Explaining it over and over is not going to change anything. So the doctor really has taught me that over the last few visits, that I'm going to say this way, in this manner, and then I'm going to stop talking, and then I'm going to go over here and do what I need to do, and then I'm going to come back to you. And that is how her internal medicine doctor has also managed to do things. He'll be talking to me, and my mom will be over here, usually on my right, yelling, hollering, angry, and he just continues to focus on me and talk to me. He answers her questions in a gentle way in just a few simple words, but he does continue to talk. And he doesn't let that behavior over here interfere with anything that he's doing with me as her caregiver. In Alzheimer's disease, that explicit memory area is not functioning well. It might be severely damaged, but the memory area, the emotional part, is still intact. This is what I'm learning. How can that be? I don't know. I really would like to understand that better. And every time I go to the clinic and talk to them about my mom, I ask all of these questions. How could this be? If this is, then why this? And what do we do now? And how do we make this transition from home health assistance to into a facility when somebody is screaming no? It's kind of like, can you drag somebody? As I've said in all of my other videos, you cannot physically drag a person into a long-term care facility, assisted living, adult family home, hospital, down to the OR you go, kicking and screaming, we're going to force you in. That does not happen. It is illegal. And forcing somebody into a facility when they don't want to go and they still have some verbal ability and understanding of their life, you cannot kidnap them and make them go. But the facility doesn't want to accept them unless they're going to get through the door anyway. It's where we're at. We're at this in the middle area. You can gently persuade, as we do with patients, but usually we can persuade them to do the possible right thing. Like, yes, sir, you are having a heart attack. Here's your cardiologist. The cardiologist wants to do this procedure. And the cardiologist will explain why. But remember that you're talking to somebody who has executive functioning, reasoning capabilities. That's what makes Alzheimer's so incredibly, incredibly challenging. And very, very hard to watch. So while these pathways that involve emotional memories are still intact and we see it, we will just continue on with these sorts of things. Gentle persuasion, talking, gentle conversations, trying not to force, trying to keep to a routine so that the expectation isn't, it is there. Kind of. The expectation is there rather than it being a big surprise, and then the surprise will evoke this big emotion. But you can't get out of it 100%. There is no way. And if somebody has, please let me know. I already watched Tipa Snow. I already go to a brain wellness clinic. I already have 2 physicians that specialize in this. One is a psychiatric gerontologist. The other one is an Alzheimer's geriatrician. She goes to the best internal medicine doctor around, and I've known him for many years personally as working with him in the hospital. I don't have any tricks, and they don't have any tricks either. So we'll hope that this new caregiver works out, that my mom will learn to accept her, and I will keep you guys posted. If this topic was interesting about somatic memories, emotional memories, and how and why people have them, and each person displays it a little bit differently. I've explained how somebody with Alzheimer's might display it and how a young child in elementary school has displayed it. I have a husband as well who has had a lot of trauma in his childhood that after I was married 24 years, then I discovered it. And it didn't show itself until after he came back from. That's a whole nother story, isn't it? About why events like that can sometimes prompt or bring out other things in the past that we've been traumatized over. My husband had EMDR and hypnosis from a trauma therapist, and I wouldn't have believed it had I not witnessed it, lived with it, and seen it for myself, how miraculously that can work. You, of course, have to be willing and able to do things like that, if that's the kind of thing that you need, if that's what you and your provider have talked about. I'm just giving you an example of how traumatic events that come out in physical and emotional memories can sometimes go away. And they sure did for my husband. I wish he would come on someday and explain it. He's very open about it. He doesn't want people to suffer. He wants to share his story of what worked for him and what absolutely dissolved those emotional traumatic events that stemmed from childhood forward, and how we can compartmentalize those traumatic events for years and years and years, and then they come out for one reason or another. Or in my mom's case, she's 88. Why are we seeing these things now? It's a very interesting thing. I'm not a psychologist, I'm not a physician, I'm not a counselor, but I just want to share whatever it is that I learn in case it might help you or somebody you love. Please share. Please give it a thumbs up. I'm trying really hard to get my channel out there. And as you all know, if you watch YouTube, unless you interact with the person or you share, like, subscribe, especially to their channel, they are never, ever seen. And I want to be seen out there for any content that might be helpful to somebody else. That's my whole goal. Less suffering. Consider subscribing if this kind of information is helpful, useful. If you like things about medical myths, about medical facts, about medical oopsies, about how we get through difficult things in difficult times, just consider coming back for another video. I'll see you then.